Are common HPV myths about cervical cancer true? Many people have questions about human papillomavirus and its connection to cervical cancer. Let's explore some common myths and the facts that clarify them. First, there's a myth that if you have HPV, you will probably get cervical cancer. The truth is that HPV is very common. About 80% of women will have it at some point in their lives. However, cervical cancer is rare. Most HPV infections clear up on their own without causing serious health issues. Only persistent infections with high-risk HPV types, especially HPV 16 and 18, can lead to cervical precancers and eventually cancer over many years. Another myth suggests that only promiscuous women get HPV. In reality, any sexually active person can contract HPV, even if they have only one partner. HPV spreads through skin-to-skin contact during sexual activity and can remain dormant for years. It does not indicate infidelity or promiscuity. Some believe that a regular Pap test alone is enough to protect against cervical cancer. This is misleading. Pap tests can detect abnormal cervical cells but do not test for HPV itself. Combining Pap tests with HPV testing improves early detection and prevention. Regular screenings are crucial because HPV can stay dormant, and cervical changes can develop long after an infection. There is also a myth that you don't need cervical cancer screening if you're not currently sexually active. This is not true. HPV can remain dormant for years, so even if you are not sexually active, screening is important for detecting any abnormal changes early. Another common misconception is that HPV vaccination is not effective or can cause infertility. In fact, HPV vaccines are highly effective at preventing infections with the most dangerous HPV types that cause cervical cancer. They are safe and have been extensively studied. There is no evidence linking HPV vaccination to infertility. In fact, vaccination helps protect fertility by preventing cervical disease that might require treatments affecting reproductive health. Some people think that an abnormal Pap test means you have cancer or have been unfaithful. This is incorrect. An abnormal Pap test indicates some changes in cervical cells, often caused by HPV, but it does not mean cancer is present. It also does not imply infidelity since HPV can persist silently for years. Cervical cancer develops slowly, often over decades, which allows time for detection and treatment of precancerous changes. Risk factors that can increase the chance of HPV persistence and progression include smoking, a weakened immune system, HIV infection, and certain medications. Quitting smoking and following screening guidelines can significantly reduce the risk of cervical cancer. In summary, many myths about HPV stem from misunderstandings regarding its prevalence, transmission, and the natural history of cervical cancer. Understanding the facts and engaging in regular screening, along with HPV vaccination, are the best defenses against cervical cancer. Always consult healthcare professionals for personalized medical advice.